Clovis has developed a solution that meets the needs of remote patient monitoring, RPM, within the Medicare system. This service is available to a wide audience, including up to 17 million people in the U.S., who are dealing with chronic conditions from their homes and can benefit from this service. The RPM service offers reimbursement for both home monitoring devices and the software platform to Medicare recipients. These devices are designed to collect health data from users at home and transmit it securely to a health data platform, all while adhering to strict privacy guidelines. The data gathered will be processed through Clovis AI Nurse. Should there be a decline in the recipient's condition or if they are trending badly, the details will be forwarded to both the doctor and a family member, following the established protocols. The distinguishing feature of this business model is the active encouragement from Medicare for all hospitals and doctors to integrate RPM services. Medicare typically disburses an average of $720 per year for RPM, which constitutes a steady stream of income for the provider or doctor. Given the support for RPM from both payors and physicians, Clovis anticipated a rapid and steady flow of sales. Yet, there's an unexpected hurdle with patient participation. For RPM services to be covered by Medicare, patients are required to monitor their vital signs a minimum of 16 days per month. This level of patient engagement, unexpectedly, become a hurdle to accomplish. After considering the unwillingness of patients to download health vitals on a regular basis, Clovis combined the cellular DR watch with a HIPAA-compliant software platform and eliminated 99% of patient involvement. The only action required from patients is to wear the watch. Clovis will offer this new business model directly to the doctor as a rental program. The doctor is reimbursed $60 per month per patient to supply RPM service to their patient, and Clovis rents their software platform that includes the DR watch to the doctor for $40 per month per patient. Clovis will generate an annual profit margin of 58%. That should last the lifetime of the patient. It's truly remarkable to observe that the annual profit margin stands at an impressive 58%. This level of recurring profitability is astounding. However, it's essential for Clovis to have a stock of 5,000 DR watches to ensure a strong foundation for natural growth moving forward. What makes the DR watch stand out? Clovis offers the first essential watch made in the USA capable of monitoring personal health metrics, collecting data from independent devices, and sending this information through cellular service. The watch will monitor the host health vitals from their wrist that include temperature, blood oxygen, heart rate, blood pressure, activity, sleep tracking, stress level, and abnormal heart rate, and will also collect measurements from other home monitoring equipment that Clovis supplies, like the pill dispenser, glucose meter, and weight scale.
The firmware embedded into the DR watch is designed to receive Bluetooth transmissions from the pill dispenser and the other standalone products, then upload the collected data to the health cloud using cellular service. This technological breakthrough was years in the making, and we commend Victor Tranny for his due diligence and fortitude of incorporating all of the complex features into the watch.
The DR watch will remind the host when it is time to take their medication and record the time and date when the medication was taken.
As the patient's medical professional, the DR watch gives me information that is traditionally not available. Knowing if and when the medication is taken is good information. 50% of people who arrive in the emergency room over the age of 65 is related to under or over-medicated. Smart Diabetes Glucose Meter is FDA approved and designed for home monitoring use. The meter and software has too many features to discuss all of them in this video. However, the meter exceeds all the requirements a doctor would want, and no need for the patient to use a logbook to record readings if the patient qualifies. For continuous glucose monitoring, the Dexcom CGM product will communicate automatically with the DR watch.
The glucose test results will transfer through Bluetooth technology from the meter to the DR watch, and then to the health cloud.
I can be alerted by text, email, or IVR. if the patient is trending badly and is in need of assistance. I can also connect to my patient by text, email, or speak to them through the watch. Tracking sudden changes in weight, whether it's gaining or losing, is crucial, as these fluctuations may signal underlying health issues that could remain undetected without proper monitoring. I will be alerted when my patient's weight changes, exceeding the limits I have established for them.
It isn't only Clovis products that can connect to the DR watch. Any Bluetooth-capable product in the market can have connection, with a small amount of cooperation from the manufacturer.
Another market that the DR watch works well with is the federally qualified health centers, and they are reimbursed through HCPCS code G0511. Similar to Medicare RPM, the patient must test their vitals a minimum of 16 times per month, and the watch does much more than the minimum. The third market is the Personal Emergency Response Service, referenced as PERS. There are many different companies marketing for this business, and they all have different apparatus they offer to their clients. Nothing they offer can also be utilized for the RPM or FQHC markets. The DR watch, equipped with GPS and the capability to gather client stats before an emergency, offers immense value to first responders and medical teams awaiting the ambulance's arrival at the emergency room. By simply tapping the watch face 3 times, the client activates an emergency alert. Following this, the built-in cellular SIM card allows the emergency response assistant to communicate with the client, and this communication can be directly transferred to the emergency team.